Welcome to Christian Health Benefits for Christian Employers. My name's John. I'm here with Remodel Health. We've got Mark with MediShare, and we're really grateful to be together again. We've done some other webinars. They've been very popular, and so we want to continue to add value to your life and your ministry. And today we're going to go through a little bit of content. We're also going to answer some questions at the end. And again, just as Mark and I have been sharing, we all kind of understand this Zoom thing. If something goes awry, I apologize ahead of time. But my goal is send me over questions in the Q&A section in your toolbar on Zoom. I'd love to systematically answer as many as I can at the end of this. If I cannot answer all your questions, and I probably won't, I'd be happy to connect with you directly, get you your answers so that you do not leave empty-handed. Mark, if you don't mind, I think I'm just going to jump right into kind of the agenda and set us up if that's okay with you.
Let's do it.
Let's do it. Well, we've been running a kind of a campaign of sorts, really letting people know this fun phrase of have your cake and eat it too. And the concept is health benefits you can believe in at a cost you can afford. We're going to unpack that today. The title of the webinar kind of says it all: Christian health benefits for Christian employers. An added benefit to this is also savings. It's not the exclusive reason we go after, but it sure is an incredible benefit in this particular economy right now. With that said, I do want to make sure and just kind of highlight what we are going to be walking through. This is the agenda. I always like telling people where we're going to go so you can kind of know that it's worth hanging on for, and are we going to hit everything? I'll give us a little bit of an overview. I'm a subject matter expert in all things health insurance and health benefits here in the United States. So I'll set the landscape, but then I really am looking forward to giving possibly a reintroduction of MediShare. And that's what we've got Mark here to do. He's an expert in Christian care ministries and MediShare and all that they are doing. We do not have time to go through all of the incredible features. So our goal is to give you again a reintroduction. Then we are going to talk about some of the biggest reasons that a group hasn't tried to use the method we're talking about today of MediShare and getting a Christian health benefit to their team. I am going to really try to give as many of the key details as possible about Remodel Health powering all of this together with MediShare. And if this is not even making sense yet, I promise it will be before you end this webinar. Then we're going to specifically talk about HSA and HRA. If you don't know what those are, I will explain them. If you do know, then that means you're probably excited. And then we're going to get into your questions. Again, please send them before the end. It always gets awkward if I'm not queued up with questions when we start asking. So send them in the Q&A. If you can't find it, the chat's fine, but I prefer the Q&A. It's the most likely way I'll get your question answered. So again, my name is John Staub. We got Mark James with us. This is a very special partnership in joining together of believers to serve the Big C Church, as we call it, because we believe that there's a big impact to be made. I do want to share, to get us started, why I'm here. I actually was a pastor for 10 years. And sometimes people have said I don't look old enough, but I can promise you that when I get up out of the bed in the morning, my back is still telling me I'm old enough to have worked in ministry for a decade. And so I'm really grateful to have been able to be a pastor for 10 years. Before that, I was a missionary on the mission field. And ministry is not only just a part of my life, but I consider even the seat I sit in today part of the ministry that God's called me to do. And so how did I get here today, and what has led me here? Well, let me take you to my first full-time church job where I was offered salary plus benefits. It's that moment in many people's life that they kind of know that they maybe have arrived. Like, yes, I got the big boy job is kind of what I was thinking. Went to that meeting thinking it was going to be one thing, and it was super boring, very complicated, and it cost way more than I thought it was going to. I thought it was a benefit. It did not feel like it. And I was pretty frustrated. Thankfully, an older and wiser coworker walked over to me, noticed me and my frustration, and said, "Hey, can I explain this to you so you can, manage it better for you and your family?" And I loved all of the advice. This individual put it in normal terms and actually gave me something to do about it. And it ended up saving my family thousands of dollars that year, simply because someone helped me to learn. And really, I walked away from that never thinking I was going to be teaching on health benefits, but I certainly wanted to make sure that everyone had the opportunity to learn what I did. Fast forward several years, I had one of those infamous budget meetings for the church. It was an emergency budget meeting. All the department heads were gathered. And what happened is I was going to have to completely change the budget that I had spent so much time on with me and my team and all of our ministry dreams, because our health insurance costs had doubled that year. So the organization was going to, absorb a lot of the cost, put a little bit on the employees, and then they let the employees know, hey, next year you need to expect to spend a lot more. And I remember kind of the way that felt, that ministry was being impacted negatively because of something we had to have, health insurance and health benefits. And I just wished that something else could happen. And I had to cut my budget in half that year, just to be very specific. I think we've all seen that or heard about that, most likely experienced it, but it's been tens of thousands of people all over the United States have felt that same pain. Well, fast forward again to just 4 years ago, when one of the founders of Remodel Health reached out to me and chased me down and said, "Hey, I want to take you to get some chips and salsa. Please let me tell you what we do." I was not interested in that. At this point in my life, I had already been frustrated with health benefits and had seen the way it had negatively impacted what I had wanted to do. And he let me know the tremendous impact that he was able to make by being smarter with health benefits. And, he told me all about the data trends and the way the new laws had changed and made new opportunities and new products that I had never heard of. And I said, I'm all in on this. The particular thing that he grabbed me with was telling me that here in my state of Indiana, I'm a Hoosier, born and raised, loved my state. They had been able to see churches gain $1 million back into their ministry budgets because of a few of these changes that they had been able to make without cutting any sort of quality and coverage to their benefits. That was huge for me. And it took me back all the way to my very first open enrollment meeting. I say all of that to say that you might have already had your open enrollment meeting this year. You might, have it today or next week. We know we're in that season right now. We're looking ahead to 2022 and then looking at the bills that we have right now to take care of our teams, whether you're a Christian small business owner or a nonprofit or a school, whatever you might represent. The weight of that decision, whether you've made it or not made it, is heavy. My goal today is to help you rethink the way you've always thought about that. And so thank you for listening to my introduction. Very passionate about being here today. Mark, you've heard this story 1,000 times. Thank you for listening again. I'm going to keep us moving forward with a little bit of an overview. And I promise from now, we're going to really, really skip through the data very quickly. So I want to present to you just some facts. The reality is that group health plans, traditional group health plans, are dying the same way that pension plans died back in the 1980s. So I want you to look at this little trajectory dip. And when you're, doing data analytics and this sort of space, you're always looking to similar industries or similar, companies or any sort of investment opportunities and money. Look for similar trends. And there's a similar trend that happened in pension plans that is happening right now, has been over about the past 10 years with traditional group health plans. Look at that line right there. And so this is data from the Department of Labor, by the way. And I don't know why it went backward. I'm trying to go forward. There we go. That little line right there. Now combine these data points, and these actually are not the most recent. I just today got the freshest data on all of the enrollment numbers from 2022. Haven't had a chance to sit down. It's a lot to absorb. So this would have been kind of mid 2021 data. 30% of total compensation going to benefits. 98% of employers say, I'm going to change something. I can't do it anymore. $15,000 per employee on average. Look at this data trend. Same exact thing as pension plans. That same trend down, and there are fewer traditional group health plans today than there have been since it was like 1999 was its last peak. And there's a reason, and that's the data points that we just showed you right there. So Harvard caught on to this. They've got two wonderful articles explaining that traditional group is just dead. It's dying. It takes time for, something that has just been so normal to eventually fizzle out. But what's happening is Harvard says, give employees cash to purchase their own insurance. And what they're unpacking here is that the old traditional group plans getting too expensive, plans are getting worse. And the new opportunity of getting individuals into individual plans is the future of health benefits. And so this is traditional, that kind of one size fits all pension plan style, into managed individual. So managed individual, hang on to that term right there. So managed individual is similar to 401ks. So we're all very familiar with that in the nonprofit space, 403bs. And this concept is the employer wants to provide a retirement benefit. Well, back in the day with pension plans, you'd have to gather all the money, manage everything, pick one plan, one size fits all. Sounds pretty familiar. And then you give it to everybody. Well, what happened is it got too expensive. One size didn't fit all, because the younger people would want a more aggressive investment so it could get them more money, while the older people that were closer to retirement would want it to be more conservative. It didn't make sense anymore. So then pension plans were replaced by 401ks. Managed individual is the 401k of health benefits. And what this allows us to do is, instead of those group plans, we can take individual plans and make them kind of feel like they're on a group chassis and manage the individual plans. And the reason why this is very, very popular, and actually this is my next slide, is talking about the popularity. The Department of Labor is projecting anywhere, and this is not just Christian organizations, this is all companies, all organizations in the United States, in around 3 to 5 years, they're projecting 800,000 to 1 million employers will send 11 million people over to this new model, managed individual style of health benefits. It's the fastest growing, it's the most popular. And here is why. And hopefully you're starting to see how we're going to funnel this into this wonderful conversation with MediShare today. In managed individuals, there are these new things that become unlocked, new opportunities that the employer didn't have a really reasonable way of participating in these individual plans because it was awkward. And so with the help and advent of managed individual, sharing programs have now become available for the entire group. And there's a couple caveats that actually solve some of the problems that you probably are bringing up right now in your own brain. We're going to talk about that. But sharing programs are available in managed individual. And it's amazing to see such a wonderful product now be available for all groups. Now, with all groups, again, we're going to talk about what that looks like. But Mark, I'm going to hand this to you now. They've been listening to me talk for far too long, and I'm looking forward to hearing you chat. I've got control of your slides, Mark. So you just tell me kind of when you want to change up the, change slides and everything. But Mark, talk to us about MediShare as, this Christian health benefit that we're highlighting today that's now been unlocked because of Managed Individual. But let's talk about this amazing, amazing Christian solution.
Awesome. John, thank you. Well said. And we'll roll to the next slide. So a little history lesson around MediShare. Some of you may or may not be familiar. We have our own garage story, as we like to say here at MediShare. Our founder, our late founder, John Reinhold Sr., had a vision for bringing innovative healthcare to Christians across the nation. And he founded Christian Care Ministry / MediShare out of his garage in 1993. Biblically based, really emulating the early church that we see in scripture in Acts of Christians coming together to share one another's burdens. And if we go to the next slide and we fast forward 28 years, we're really excited to say that we think we're doing an okay job. There's still the best is yet to come, but now with over 700 plus employees, we'd have to have a big garage to house that many folks. But now in our corporate offices in Florida and Colorado and in 35 states across the nation, our employees come together to serve over 400,000 Christians with this innovative healthcare solution called MediShare. So we're really excited. Team's done a great job, and we appreciate our members for really believing in what our founder had put there. Real quick on the vision and mission, John, if you can just go back, I'm going to point out two words. One on the vision. So as we think about today, go forward for MediShare, transforming society is just a really important piece of our overall vision statement. I think the first is pretty obvious. We believe the biblical model of sharing is transformative just in its very nature, even though it's been around since the early church. The second piece that may not be as obvious is we believe that transforming society is really advancing the kingdom, transforming society in the name of Christ. And the work that we do here at MediShare, we are a point on the spectrum of helping point people to our Father in heaven. And so that transformative power is really, really important to us. In the mission, I'll just really quick point out Christ-centered community wellness. Wellness is a normalized word these days, but for us, when we think Christ-centered wellness, that's spiritual, mental, and physical. And so within the MediShare stratosphere, there are things we're doing like adding mental health for free as part of the MediShare product to serve certain pieces of Christ-centered wellness. So just want to point that out. And as we flip to the next slide, I won't read all these numbers. I'm going to talk about two, one that's on the slide and one that's not. But this just gives you an idea of what's going on in the back room. The first number that's not on the slide, and one that I find people sometimes are a little surprised by, is just the size of MediShare. We are 750 million in annual revenues, and we are the largest healthcare sharing organization / brand in the nation. And the other item I'll point out that is on the slide that you will not find on our website, you will not find in a brochure, because we just don't think it's something that makes sense to sort of be in the marketing sphere. But we want to share with you all today, since you've taken the time to come, is the number of 80,000 hours of prayer with our members and our care providers. And we put pen to paper and we just began doing the math of how many prayer moments we're having with our audience, and it came out to around 80,000 hours. So that really links back to our vision and our mission, and the fact that, at MediShare, we can always do better. but we really are leaning into this idea of Christ-centered wellness and transforming society. And we get a lot of feedback from our members about that. So I just wanted to share that with the audience today.
Hey, Mark, I'd love to share something very quick. I apologize
Please.
for
No, please.
hijacking your cadence.
No, go for it.
The prayer that you mentioned. So, being a Medishare member is personal to me. So I want to make sure everyone knows that I'm not just representing something I don't have experience with. But I remember getting a phone call. I had Medishare programmed into my phone, and getting a phone call from Medishare and going, oh no, what did I do? Like, it's that normal feeling. You don't want to get the phone call from whoever your health benefit is. I answered it, and the only reason I was being called was to make sure and ask if I needed any prayer. That was it. There wasn't anything else like, hey, just want to make sure you renew with us, or nothing. It was just, hey, I'm calling you, John. And I did. I had something that was, I've been thinking about, and it very much helped me feel cared for in a very, that body, soul, and spirit. That was amazing for me to genuinely feel cared for. Nothing else, there's no other reason for the call except for that. So anyway, had to share it. Thanks for letting me
No,
hijack your flow, but
no,
I
not at all.
love that about Medishare. So
Not at
thanks
all.
for letting me
We're
share.
here to have a conversation. I appreciate you sharing that. In
Yeah.
fact, we had another John, a member from Waco, Texas, just speak to, and we do this on a regular basis, speak to our leadership team just about his experience. He's actually a judge in his town, and he's been on Medishare. He's a homeschooler, and they just felt drawn, been with Medishare for 4 years. And like most members, and like you just said, John, one of the things when we engage them in conversation that they always come back to is how different the experience is.
Mhm.
And I think if we go to the next slide, it's one of the reasons that you'll see there 98% customer satisfaction rate.
Yeah.
It's not that we don't make mistakes. It doesn't mean that we don't falter occasionally, but by and large, from hundreds of thousands of interactions with members, we have a very high customer satisfaction rate, and it's twice what the healthcare or health insurance industry has. And so that's a testament to our members, our team at large, et cetera. There's a lot here on this page. I just want to let the audience know you can go to medishare.com. You can go to Medishare Difference, MS Difference, and you can access this, read it at your leisure. I'm just going to give you a quick tour of key things that really people speak back to us that they really appreciate about Medishare. And so the very first item is direct bill management and then quick share. And those two go together. So direct bill management, just think of that as you go to the doctor's office, you show your Medishare member card, and the bills come to Medishare. And we take care of the rest. We advocate, we negotiate, et cetera. And once we get the bill, that's where quick share comes in. We pay 90% of the bills within 30 days. And that is top quartile performance, even in the health insurance industry at large. So really, really important. We are the convenience model in the healthcare sharing space. And it's one of the reasons people are attracted among, and I could fill in the gap of many more, but it's one of the reasons people are attracted to us. A second item is down in that middle column towards the bottom. And that is just the fact that no annual caps, no lifetime limits, no requalification for membership. So we've had bills that exceed $2 million, $1 million, several $100,000, and we pay those just like a $25,000 once our team advocates, negotiates, et cetera. And then the final, and really, really, it's always important, but aligned with your values. And I'll simply say to our audience, maybe some of you can relate to this. It seems like in a moment in time such as this, in our great nation that we all have the privilege of living in, being associated with organizations like Remodel Health and Medishare that are aligned with your values are just really, really important. And these are member voted guidelines. And so the member's voice is huge, aligned with your values and biblically based. And so we take that very seriously by even just some of the other things I've already mentioned, but we are appreciative. And so John, that's the quick 25-cent tour, and
Great.
I will push it back to you, man.
Great. I appreciate that. I added this slide here, Mark, because there's one more piece I personally like to highlight. It's
Yeah.
another thing I'm a
Yeah.
big fan of.
Yeah.
Is the updates on how my participation as a member and my share and where the share and the impact it's going. I love those updates. You know, it's not, to me, it moves your, the cost into actual community. It takes that cost into actually caring for one another and bearing one another's burden. So just honestly, thank you. And thank you all at MediShare. You can kind of see some screenshots here. One of my favorite features, just want to make sure, kind of shameless plug on behalf of MediShare right there for how awesome you guys are.
I love it. We have a member testimonial that is getting ready to go on a TV ad, actually. And the members use these words. These are not our words. They said, we joined MediShare and we felt known.
Wow.
And it's a community. So you're spot on, and I appreciate you sharing that.
Yeah, thanks. So let's move into the third topic. This is one of the things that excites me about this conversation as it relates to MediShare for your organization, powered by Remodel Health. So let's talk about some of the key reasons that you have been able to you've heard of groups, maybe even self-selecting out of even having a conversation or an analysis because they're like, it's not for me because, or this is why I know it's not going to work for my group. We hear that all the time, Mark. I have a couple that I'll, if you don't hit them first, that I'd like to share, but you're on the ground level of making sure and getting people connected with this wonderful community. And what are some of those key reasons that you see people self-select out?
Yeah, well, and I even saw someone put in chat, and probably the number one item is pre-existing conditions. And to be very specific, probably the number one item is, hey, I had cancer 12 months ago. Can I join MediShare? Well, you can join. You sign our statement of faith. Anyone can join, but what we will do is we will make sure through the questionnaire that if you had that and it is deemed a pre-existing condition, there's a waiting period before that need associated with the cancer would be shared. And so then we give the prospective member an opportunity to make a decision. Interesting enough, 11% of the folks we have a conversation with about pre-existing conditions end up joining MediShare. Wow. So we always say, do not self-select out. It's very easy to enter in, go through our process, and we believe in fit emphatically. We want people in the program that it makes sense, and for those who don't, we'll have the conversation, and there are other alternatives. So that's number one. Number two is really the design of our model here at MediShare, and it would fit in what, in the healthcare space, we would call preventative. To put it in layman's terms, I'd say it's routine medical visits. Our model is the member's responsibility is to take care of those routine medical visits. We'll cover some labs and annual physical, but generally routine medical visits are the member's responsibility. We take care of, the bigger stuff. However, because of the affordability of MediShare, the trade-off is still way, way better for our members. That's what they tell us. But preventative is part of traditional healthcare. So we've all been raised with that in mind. So it's something that we get asked about. And then the third, John, and you may have some, a couple other vantage points, would be just fit. So we talked to an employer just a week ago. They have 25 employees. And one of the first questions is, well, what if 23 qualify, or it would work better for to be on Medishare and 2 don't? What do we do? And I said, man, that is such a great question. We have solutions because we have a partnership with Remodel Health. And so, I'll flip it back to you. I'm sure you can speak into that a bit, but those are probably the top three questions that we get.
Yeah, so I just want to reflect these back from what I'm hearing from you, Mark. I'm hearing the first one is people self-selecting out because they have what they believe is a pre-existing condition. They don't think, there's any solution for their entire group because either they have a pre-existing condition, someone they know has a pre-existing, so they just self-select the whole group out.
Yep.
Sneak peek, we're going to talk about that in just a second here, so that's really good. The second you mentioned is preventative, and this is, in case, just to clarify again, I found that saying the same thing multiple times in health benefits is helpful. Preventative being screenings, vaccinations, checkups, well visits, those sorts of things.
Yep.
People are nervous about, the idea of paying for those visits because they're normally free, included with your premium, but they're normally covered. And so what do I do there? Those two are very interesting for me. And then you mentioned fit, the idea that most employers presume if Medishare isn't the best fit or what someone would, if everyone doesn't fit, then it's not good for anyone. Right. And that's maybe people kind of can feel me building up the wave here, and that's on purpose. That's what we're here for. I want to tell you too, in case any of you have to jump off of this webinar early, and we're at about 34 minutes in, we will wrap up by the end of the hour. We're kind of coming to our big points right now. You can run an analysis to see if this can work for you, okay? Please run an analysis. If this is at all interesting to you, it's a risk-free analysis. You don't have to worry about it. You'll get a full picture of what this can look like. So just remember that if you have to leave early, maybe that'll just keep you guys staying. But let's talk about Remodel Health. So Mark, I unpacked at the beginning this idea of managed individual, the 401k of health benefits, and people get to be on individual plans, and because it's now individual plans are unlocked, individual products like Medishare are available to be managed in a group. So we kind of, we go from group down to managed individual and then back out to make it feel like you can have Medishare for your entire organization or for many of your organization. And how does that kind of work? The very basics to this is that it has to do with that same 401k concept. The employer determines the money to give over to the employee, and then the employee can use that money to get onto Medishare. That's the very basic thing. And then we combine all of that together. Remodel Health has a software and a platform to be able to do all of this, but that's sort of the underworking of what's happening. But here is the magic ingredient, okay? Those of you who are wondering, it's like, hey, I know Medishare would not be a good fit for me, or you have a really good friend on staff. I know it's not. They're in the middle of something right now. They have to have something that will help with all of those bills. They can't go through a waiting period. That's okay, because that's what we designed our solution to power up Medishare. So the reality is Medishare is an incredible opportunity for so many people, but yes, there might be, one that might have a pre-existing that should not go to Medishare, and that's okay. That's okay. There's another opportunity here as well that I like to kind of highlight is Medicare, especially in the church space. I've seen a lot of times there's a Medicare eligible employee that just doesn't have all the information they need. They're maybe a little nervous because they don't have someone to walk alongside them. What we do at Remodel Health, we analyze the entire organization. We make sure to find out who is going to be a good fit for Medishare, and we can design everything around that. But then for those people that might have a pre-existing condition, we're going to get them into something that takes care of them where they need it for right now. And then also for Medicare, we can get people into Medicare plans that are going to be just an incredible plan. That's one of the most popular health insurance solutions in the United States. And we walk alongside them in that process as well. And the reason why we want to do that, and I don't know that I have a slide on here because I like to help people understand conceptually. Remodel has helped save using this whole like Medishare, empowered by Medishare, and this managed individual model. We have seen $65 million go back into Christian organizations since we just started doing all of this. $65 million has been taken away from those expensive line items that are just obligatory for health benefits. $65 million has gone back into Christian ministries of all shapes and sizes. I'm kind of using a broad term there. So that's why I'm excited about this. I'm going to pivot back over here to the benefit of Medishare powered by Remodel Health. First, a national PPO network. I did a little sneak preview, Mark, and I'm going to send you a question about network and everything at the end. So just hang on to your hat there. We're going to get to that, but there is a national PPO network available with Medishare. Incredible. It's just awesome. Here is something special about the Remodel Health and Medishare duo, HSA eligibility. So I'm not going to go into the details of that. It is very complex. But the reality is, when you do the managed individual model, we are able to bring HSA eligibility alongside Medishare. Okay. So that means that either your employees can put money into the HSA and the employer can put money into the HSA, especially if you do find a ton of savings. Bless your people with a bunch of health savings account dollars. Incredible. Okay. Here's something else. Preventative care. We bring at Remodel Health preventative care alongside Medishare. So again, those first two contentions that Mark already had shared about, I've got one person, I'm going to self-select the entire group out. Maybe we can take care of that one person, and it's a huge, great, amazing fit. Preventative care. If y'all are worried about your screenings and vaccinations and your checkups and wellness, we actually bring alongside preventative care with Medishare. Just amazing. So because of this, we're able to actually help make the I like to call it the worst year. If you have everything bad happen to you, to your entire family, and all the thresholds are hit everywhere, what happens? Well, when we structure it like this, we actually make the benefit better. Okay. So you would have a better worst year in this sort of a structure as well. So we've got a software management around it. We've got account care teams to make sure that you have the same person every time you call in. I know that's really important when we're talking about caring for a group. And so these are some things I'm really excited about. We got telehealth, ancillary, payroll deduct, is another thing that's really special about this solution. I don't need to go into it too much. I want to make sure and get into some of the questions here in just a moment, but here's something else. Mark, why don't you talk about telehealth? I've used it. My wife has used it, but just talk about, how you guys have seen telehealth regularly work with Medishare specifically. Obviously, it's one of the fastest growing solutions in the United States for getting care quickly and affordably, but talk about Medishare and then what you guys have to offer alongside that.
Yeah, no, thank you. So as you see on the screen, it's 24/7 access to board certified physicians at a zero cost to the member. Some organizations, even health insurance or traditional health insurance organizations, sometimes charge for telehealth. We don't at Medishare. It is especially post-COVID, John, as I think and I'm sure some of our audience used telehealth for the first time during COVID. So there's just been a huge progression in that direction. And it's a benefit. We're seeing it peak as far as utilization goes here at MediShare, and we're thrilled because at any time you can get that, they can call in whatever they need to call in, give the right direction. It's convenient, it's free, it's easy.
Yeah, I love that.
We love it. And I already mentioned, but I will add, we also added free mental health. You'll see it on the website as virtual counseling. So we have, the world of mental health is becoming more and more normalized. It's not, we all have challenges and we realize that. And so under the guise of Christ-centered wellness, we've added that. And I will share that, we've had people call that were really thinking about their life and, should they end it? And so we've been able to be there for people in those situations and others. And so it's something that our members are beginning to use more and more since it's been available over the last year.
Wow. Thanks for sharing that. Body, soul, and spirit, total wellness, being part of a Christian community. As I'm reflecting on all the content we're sharing today, Mark, I'd imagine people might be a little overwhelmed by how much, and I want to encourage you, if you're feeling that way, we have built this by design to be an overwhelming blessing to your people so that they can have the best benefit experience they've ever had. That's really the goal. The goal is not to find a budget product that has a Christian label on it so you can feel good and save money. This is genuinely helping your people and helping your ministry, getting dollars back where they need to be and enhancing the whole total wellness of your staff along the way. I want to hit one last thing. I kind of mentioned this about the HSA eligibility, preventative coverage. I'll hit this quickly. Only about 8% of people actually even use their preventative. So it's funny, Mark, that people self-select out of MediShare because they don't have preventative, even though so many of us don't use it. I have been guilty. My wife helps me go to the doctor when I need to now. But with that said, we want to make sure that you will have that when you have MediShare powered by Remodel Health for your organization. Very, very helpful there. This is the concept right here of let's say that there is tremendous savings. Okay, let's just walk down that path for a second. There's tremendous savings by going manage individual, using sharing ministries. Okay, that's great. This is the next step, and it's really important. I want to make sure that you're thinking of that better benefit for your team. 2 out of every 3 bankruptcies in the United States because of medical bills, and most of those people had health insurance and it still didn't cut it. So we need to make sure, and as we are looking out for our people that God's put in under our care, and we're going to make the benefits decision for them, what's the best thing you can do? And that's getting medical dollars to help them with their medical bills when they happen. And what I mean is this: in between that threshold from $0 of medical bills up to the threshold, let's say it's, $7,500, $10,000 annual household portion, something like that. How are you also helping that? It's wonderful that MediShare can help beyond that threshold. And we're going to get into that in just a second. I saw a great question on kind of that, all of those huge claims that MediShare helps with every single year, so many times. But that little gap right in there can feel like a really big gap for a lot of families. How are you as an employer leveraging savings to make a better benefit? So we've got a way to do that with health reimbursement arrangements, health savings accounts. We can bring that alongside the MediShare benefit. That's part of the power of us being together. Here is an example, brass tacks right here, of what this means. 2 things. First, savings. Okay. Look at this example of an employee, 20 employees. This is great. Now, This can go all the way down to a small organization. Let's say 5. Okay. You don't have to have 20. You can have, you can have 5. You can also have 500 or more. I'm using this as a reasonable example. We're all different. Look at the relative savings to the amount of employees here, and look at the worst out-of-pocket year, from 13,000 for the family down to 6,000. That's life-changing in many ways. This is what we're here for. Do you want more or less in your budget? I love that silly question. Of course, we want more. 65 million. I did have this slide in here, but I wanted to tell you earlier, with better benefits, that's what this is about. More money for your ministry, better care for your team. So you now might be wondering, okay, that sounds fine. What would I have to do to figure this out? Glad you asked. Thank you very much. We can run an analysis. It's a risk-free analysis. I mentioned it earlier. We'll go in, we'll compare what you're currently doing with your traditional outdated pension plan style group plan, and we'll compare it against managed individual. Leaning in as much as we can to MediShare. Don't self-select out. Look at the numbers, let the numbers speak for themselves, and see what we can actually do about it. Here is your next step. Okay. And then we're going to get into questions right now. Email me. If you have a question, email me. But I would love to have you run an analysis, get a quote. If you do run a quote, I'm going to give you $100 to Amazon. That's just my thank you for you listening to me talk so much today, and then also being willing to learn and to rethink. So if you run a quote, I'll send it to you directly. Again, that's my thank you. That's literally the least I could do. My email's right there, john.stubb@remodelhealth.com. Feel free to pull out your smartphone. You can email me now. We'll get things rolling. It's not too late here at the end of the year. Not too late. And also, if all of a sudden maybe you're kind of think about it and then it gets to be February and you forgot and you're like, oh, I remember John said it, but it was too late. You can make this change at any time. Okay. Now I'm kind of pulling back my leverage to get you to talk to me now, but hopefully you can just know, hey, just run the analysis now. There's no time better than right now to know where you're going in 2022. So we'd love to run that analysis for you. I think that is it. Yeah, so we're going to go into some questions. Mark, as I'm loading up questions here, anything to add? I'm going to I have to read, and I can't read and talk very well at the same time. Anything to add quick as a conclusion, Mark?
Yeah, not a problem. I just want to emphasize, take a look. We may not be for everybody, but we are for a lot of people. And just this morning, I had coffee with a gentleman that just joined MediShare. It was happenstance. He said, I just joined MediShare. And I said, let me ask you a question. I'm just curious. How long did you think about joining MediShare before you pulled the trigger in the last 30 days? And his answer was 2 years.
Really? And 2 years?
2 years. He said, I've been thinking about it for 2 years. And I said, what kept you from pulling the trigger or looking at it? And he said, I just wasn't sure about it. I heard about it. I met people that were on it that really liked it, but I just wasn't sure. But he never called. He never called in to have a conversation. And, I can be guilty of that also sometimes in certain areas, of my life. And so I think your compelling ask, John, and we know this from serving so many churches and faith-based organizations together, it's really allow us to have the conversation. The good news is this: if we don't believe it's the right fit based on the process we take you through, we will tell you. Yeah. We're not out to sell something, we're actually out to serve the audience that's on this webinar and the greater good. So That's our heart. That's what we're after. And so I just want to emphasize that.
I appreciate that, Mark. With a 98% satisfaction rate, I don't think you are about to start sending people into MediShare that it won't be a good fit. I mean, that's just, you can't do that. And, it puts a smile on my face, and that's normally how I answer people. And I tell them, hey, if we try to put a square peg into a round hole, you will be angry and leave us angry reviews on Google and Yelp and Facebook, and that's bad for business. So our goal is to make sure that everything we're showing you here is the intended to care for the Big C Church. So thanks for that, Mark. I am ready to give you your first question. So drum roll here. So this question is from an individual asking, the network makes a huge difference. How does yours compare with United Health and Blue Cross, especially in the Orlando, Florida area?
Yeah, so I'll start in reverse. I wish I had the command of, local city network coverage. I don't, but what I can say is that we are blessed to have an actual PPO, doctor network nationwide. Around 900,000 care providers are a part of that network. It's PHCS multi-plan. And what our members do, we have a provider network webpage. And so you're able to go and we just had a member conversation last week where he was talking about his wife who had a medical condition and she wanted a female doctor. That was her request. And so he went on to the website, he looked up folks in network, found a female doctor in his area, and they went and had a great experience. So we make it really easy. And if that isn't for you, you can pick up the phone and call one of our member services reps and they'll be glad to help you if you need that type of help or guidance. So we're excited to be in network. It's a really big benefit of being with Medishare.
I love that. Yeah, I was excited about that. I was excited about that question there. Okay, I've got another one for you, Mark. Let's talk about maternity and how that works with Medishare. And one of my mentors, actually, his wife, I believe, 2 pregnancies while they were Medishare members, at least one, but I think it was 2. And wonderful experience, by the way. So I just want to make sure Mark, that was great. Yeah. So I can vouch for the experience of that. Talk about how it works and all those sorts of details.
Yeah. So maternity, the average maternity need is under $10,000. And so those happen all the time. We love it. We believe in the sanctity of life. So here. We love babies here at Medishare. We do have a $125,000 need, we'll call it a cap or annual limit on maternity. So it is a rare day that we have a maternity situation that exceeds 125,000. But I think the natural follow-up question is, well, have you ever had that happen? And the answer is yes. Very, very limited, but it has. And the good news is, I'll just share something with the audience of, well, what happens then? We actually have a fund that is funded by our members' generosity, and it's called Extra Blessings. And so members say they have something that would exceed that limit if they've been in good standing, they've been paying their shares for 12 months, beyond 12 months. So you're in the program for a year, you're eligible to access Extra Blessings, and you can submit that and it'll be reviewed, and we pay out millions of dollars a year for situations like that. And really a lot of that goes not to this maternity situation, but just looping back, because you may say at first blush, whoa, wait a minute, who's accessing Extra Blessings? I'll give you a very good example. That 11% that joined with the pre-existing condition, so they knew about it, we talked to them about it, something happens. They're in the waiting period and something happens. They submit that for Extra Blessings if they've been in membership for 12 months. And that's a very normal thing that can happen in that situation. But that's how we handle it. Yeah. And I think I've given you enough on that one.
Yeah, that's great, Mark. It's funny when we get into the question and answer, I think sometimes people will wonder, like, are they actually going to answer the question or not? Like when you get into it, you know? And so I appreciate the nuts and bolts. I'm a nuts and bolts guy. Um, and I like learning like that, but unfortunately, it's unfortunate and also good because I feel like it's part of my giftedness is just to simplify it. So we're going to keep it simple and we're going to go right into the nuts and bolts for you. That's the way we're going to hold your hand along the way. Mark, I'm going to go through a couple different
Okay.
questions right now. I'm going to answer them, and they're just kind of reflecting the question about the network again. And
Okay.
so part of the question is the hospital network or groups do you work with? Is it HMO style or PPO style? I'll answer that as part of the PHCS
Mhm.
PPO multi-plan network. Okay. Now, this is me being a health insurance nerd, a very similar and sometimes the same network that other insurance companies will use. And so the way works is you have the insurance carrier and then you also have the network. And so like the carrier can, subscribe to the network. Gets confusing. The only thing you need to know is Medishare has a PPO national network. And so is that correct, Mark? Did I answer that right?
Yep.
Great, great. And then if you want, I've actually done this. If you want to look up the doctors in the PHCS PPO multiplan network, Medishare's got an incredible tool to find a doctor on their website. And it's very, very simple. You can Google it. And if not, if you can't find it, email me. It's right there. If you can't find the link, I'd be happy to give you the link specifically. And so, yeah, thanks for that. And you're welcome. I just saw you, someone shout out with a thank you there. So there's two other questions, Mark. I'm going to take. So what's minimum enrollment is one question, and then also can we chat about an individual plan? And so I'm going to talk about the individual thing first.
Mhm.
Medishare is an individual product that you can sign up for and you can go online and you can get connected today. Again, my email's here if you'd like me to get you connected, but Medishare is ready and available for you. Okay, so that's amazing. When it comes to managed individual, we're going to manage it all together. We would generally say 5 is kind of what we're targeting. That's because you as an organization, that's where the cost threshold is going to start making the most sense. So we'd like to see about 5 at a time. I'm going to do one more question. I think I see one more here, Mark, and then I'm going to be good with everyone's time. Are you good with that?
I'm good.
I like that we got a whole bunch of questions and that I don't know we're going to get to all of them. My email's here. Please email me. Here's the question. I'm a Christian business owner, but not all of my employees are Christians. Can I still use this? And we're going to go right back to the very solution that we're highlighting today is that Medishare for your organization, powered by Remodel Health, allows all of the employees that would be a good fit for Medishare and should go as Medishare members. But then if you do have an individual that Medishare would not be a good fit, and in this case, obviously part of the Medishare membership is we want them to be part of the community of believers. If they're not part of that community, that's okay. And we can take care of them uniquely. Okay. So I just want to make sure that's the premise, whether it's Medishare is not a good fit for a faith reason or for a pre-existing condition reason or anything else. Our goal is to make sure get as many people as we can to Medishare because it's great. And then for those that, the few that can't, we're going to take care of them where they're at. And so that's really the goal. So, Mark, any closing remarks before I let everyone go? I know we're going a minute over, but I want to let people go. Any closing statements?
I just want to say thanks to everybody taking the time. Everyone's busy. This is an important topic, and I hope at the end of the day you'll be encouraged to at least raise your hand and have a conversation. And that's really at the end of the day all we're looking to do is educate, empower, and connect. And we hope some of this information has been helpful today. And I appreciate John. He always does such a great job. I'm sure you enjoyed him. I do, even though I've heard it before. So,
Well,
John,
thank you very much, Mark. My email inbox is already flooding with people with wanting to get those analysis going. So thank you to all those emails. Again, my email address is right here. Thank you for your attendance. I'm going to get this video uploaded for you right now that are live. And if you're watching this because you missed it and you're watching it again, thanks for watching all the way to the end. That is great. Good job. Looking forward to seeing you in my email inbox, getting you connected with an analysis and helping you get MediShare for your organization, powered by Remodel Health. Thank you again, Mark, for being with us, and thank you for attending today's